What's up, everybody? It's about 11 o'clock Friday. Hope everybody is enjoying their day so far. Listen, I just wanted to talk a little bit about something. I'll start off by saying, for those of you that may know or may not know, not only am I an exercise therapist who does coaching online, but I'm also a physical therapist assistant with about 12 years of experience in the home health care setting. Right, I'm currently in the home health care setting. I've been in that setting the last 6 years. I have experience across other settings as well: inpatient, outpatient, skilled nursing facilities, so on and so forth. But I'm currently working home health now. So interesting situation came up today. I've been seeing this patient for about a month now, and he's a strength and balance patient, right? Well, every time I go, he's got a lot of questions, and I always try to make an effort to answer the questions in the best way that I know how, right? I'm not sitting here saying I'm a doctor or anything like that, but I would like to think that I know a good bit about a lot of things, right? Just because of the settings I've worked in and the years I have under my belt. I've seen some things, okay? And so I always try to educate this gentleman every time he comes. And today he had made a comment that was kind of threw me back a little bit. What he said, of everybody I've ever talked to, including my doctors and my nurses, you're the only one that really takes the time to explain things. I gotta be honest, that kind of threw me back a little bit, because I'm thinking to myself, well, isn't that kind of part of the deal? You go to the doctor, or you see a nurse or a physical therapist or anybody in the healthcare field, right? Education is part of that deal. But he was telling me that no, his doctors, they don't really spend the time with him. The nurses, they want to get in and out as fast as possible. And I'm thinking to myself, man, that's not good. But then I think to myself, we live in a society where, it's all about money. It's not so much about people as it is time and money. And that kind of saddened me a little bit. And I kind of felt bad for him, because, here I am, a home health physical therapist assistant. He's telling me I'm the only one that's taken the time to explain things to him. I also feel a sense of pride with that, though, too, because I do this with all my patients, with anybody, whether I'm training online, whether we're face-to-face, it doesn't matter. I'm going to take the time that's needed to explain things to your satisfaction to the best of my knowledge. I'm not sitting here saying I know everything about everything, but I know a little bit about a lot of things, right? I'd like to think that with my experience and everything, that I know a little bit about a lot of things. So anyway, I really appreciated the patient, saying that and making that claim, but I also feel like I kind of felt bad for him too, because how many other people are going somewhere with pain, or with some kind of dysfunction, or with, whether it's joint pain, low back pain, knee pain, shoulder pain, any kind of pain that you're experiencing, and that's the kind of treatment that they get, right? You sit at the doctor's office for 2 hours when you show up on time on your appointment, and then you sit in the little room on the little seat for 20-30 minutes, and then the doctor shows up, and maybe they do an x-ray, maybe they don't, maybe they just speak to you quickly and rush in and rush out, right? Maybe I don't know, maybe they're not spending the time with you that you really truly need, or maybe you're afraid to ask questions because of how limited time the doctor really has, and you feel rushed by the doctor, right? It really is a bad position to be in. So listen, I wanna encourage you that if you're looking for something that is a little bit more substantial, that does not adhere to the healthcare system protocol that we currently have in place, somebody who's going to take the time with you, someone who's going to answer your questions to the best of their ability, somebody who's going to actually listen to you, somebody who's going to take what you say into consideration, right? That's something that I'm offering here. Okay, I can offer that for you. All right. So if you're dealing with any kind of pain at all, and you felt like the healthcare system is failing you, maybe it's time to look at a different avenue. Maybe it's time to stop putting your trust in, just these doctors and nurses who just want to prescribe you pills and send you on your way and bill your insurance for the insurance money. Maybe it's time that we actually have a conversation with somebody who will actually listen to you, who will take your pain into consideration, who will set goals with you, who will always be there to answer and educate as to the best of his ability. This is what I can offer for you. So if that's you, if I've hit some of the things on the head for you, if you feel like, man, he's speaking right to me, I want to hear from you. I really do. I want to hear from you. Let's talk about your pain. Let's talk about your journey, because that's what it is. It's a journey, right? And you're not going to get some just mediocre consultation. We're going to take the time. We're going to sit down. We're going to talk about it. We're going to figure it out. And I'm going to make a program for you that works for you, because I'm all about you, right? So listen, I want you to get at me today. If you're dealing with pain and you feel failed by the healthcare system and these pills that you're taking aren't working, or you just feel depressed, you feel like nothing's working, I want to talk to you because I can help you. Get at me and let's conquer this pain together. We can do it together.